Again, I am going to present the cancer awareness for leukemia. So this is the month of September, and in September is the month when leukemia is considered as the main calendar list. So in the previous cancer awareness lecture, I have presented breast cancer awareness, ovarian cancer awareness, and now it is leukemia. So here I will be basically covering introduction to leukemia, definition of leukemia, incidence of leukemia, etiology and risk factors of leukemia, pathophysiological view for leukemia, leukemia types, clinical manifestations, diagnostics. Now, in introduction, here we can say cancer of hematopoietic system are disorders that result from proliferation of malignant cells. Malignant cells are originated in bone marrow, thymus, and lymphatic tissues. Blood cells that originate in bone marrow are called hematopoietic cells. Blood cells that originate in lymph are called lymphoid cells. Leukemia, cancer of bone marrow, lymphoma, cancer of lymphoid tissues. Now, in terms of definition, leukemia is a malignant disease of the blood-forming organs. Leukemia is a malignant progressive disease in which the bone marrow and other blood-forming organs produce increased number of immature abnormal leukocytes. This suppresses the production of normal blood cells, leading to anemia and other symptoms. Normal blood cells and leukemia. Here you can see the difference in the picture between the normal and leukemic cells. Here you can see clear views, the platelets, erythrocytes, monocytes, lymphocyte, neutrophils, and then abnormal proliferations could be seen. Now, incidence in India, about 3 to 4 per 100,000 populations or 1 lakh population. These people account for 30% to 52% of all childhood cancers in male and 19% to 52% in females. In 2022, there were approximately 487,000 incidence leukemia cases globally with 300,000 deaths. While leukemia is rare in adult, it's most common cancer in children and a major cause of cancer deaths in children. ALL, that is acute lymphoblastic leukemia, is the most common type in children, whereas acute myeloid leukemia, AML, and CLL, chronic lymphatic leukemia, are more common in adults. Incidence and mortality rates are higher in males than the females. Global case numbers and demographics. Total cases an estimated 487,000 incidents in 2022. Total deaths approximately 300,000. And age distribution, leukemia accounts for over 30% of childhood cancers, but less than 5% of adult cancers. Sex distributions, incidence and mortality rates are higher in male than the females, with male to female ratio of about 1.4 and 1.5 respectively. The subtypes in children, it is ALL, in adults, it is AML and CLL. Geographic and socio-economic trends. Eastern Asia, so South Central Asia and Northern America accounts for the largest percentage. And then the global burden of leukemia has generally declined from 1990s to 2021, though trends and disease burden vary by region and socio-economic status. In terms of statistics, in 2022, 487,000 incident cases, 2022, 305 deaths, 305,000 deaths. And then incidence 5.3 per 100,000 population, then mortality 3.1 per 100,000 population. Now, you can see also in this figure how it would. In terms of the figure presentation, you could clearly see the global leukemia cancer market size and the forecast. Here in 2022 and 2023, you can see how it could look like. They are increasing. The market is increasing. That means the number of patients with leukemia are increasing. In terms of type, you can see by treatment, chemotherapy, targeted therapy, immunotherapy, stem cell transplantation, and then by end user hospitals, specialty clinics, research institutes, and others. Now, if you are talking about etiology and risk factors, the exact cause is not yet known. Several factors are associated with leukemia. They include, like genetic factor, a high incidence rate of acute leukemia and chronic leukemia is reported in certain families. But if you summarize them, they are genetics or family history, chemical exposure, certain viral infections, radiation exposure, smoking, obesity. Now, hereditary abnormalities associated with an increased incidence of leukemia are Down syndrome, Fanconi, aplastic anemia, trisomy of chromosome number 13, identical twins, fraternal twins, siblings of children with leukemia are also at increased risk. Second, overexposure to ionizing radiation and chemicals, it can become a major risk factors for the development of leukemia, with disease developing years after initial exposure. Alkylating agents used to treat other cancers, especially in combination with radiation therapy, increase a person's risk of leukemia. Workers exposed to chemical agents such as benzene are at much higher risk than congenital abnormalities like Down syndrome, the presence of primary immunodeficiency, infection with human T cell leukemia virus type 1, that is STLV1. Here you can also see the exposure of normal and leukemia cells. Here, white blood cells, platelets, red blood cells. There are much difference in these cells also. Now, pathophysiology. The pathophysiology of leukemia, it involves abnormal proliferation of leukemia, failure of leukocytes to mature, metabolic complications, abnormal leukocytes cannot perform the primary function, abnormal cells crowd the bone marrow, lymph nodes, and spleen. Infection and bleeding are two common barriers. Now, the types are ALL, AML, CLL, and CML. These four types are the major types of leukemia. Now, primary difference between the four types is the rate of progression and where the cancer develops. Chronic leukemia cells do not mature all the way, so they are not as capable of defending against infections as normal lymphocytes. Acute leukemia cells begin to replicate before any immune functions have developed. Now, the ALL or acute lymphatic leukemia, most common type of leukemia in children and accounts for 15% in adults. In this type, immature lymphocytes, proliferation bone marrow, most are of B cell origin. Age are 14 approximately, before 14, peak incidence between 2 to 9 years of age and in older adults. And this is the difference between normal blood cells and newly diagnosed ALL. So the difference is clearly visible. Clinical complications: fever, pale skin, bleeding, anorexia, fatigue and weakness, bone, joint, and abdominal pain, generalized lymphadenopathy, infection, weight loss, hepatomegaly, mouth sores, splenomegaly, headache, increased ICP like nausea, vomiting, lethargy, cranial nerve dysfunction. Diagnostic evaluations: low RBC count, HB, low platelet counts, low or high WBC count, transverse lines of rarefaction at ends of metaphysis of long bones on X-rays. Then hypercellular bone marrow with lymphoblast. Lymphoblast also possible in CSF, presence of Philadelphia chromosomes. Acute myelogenous leukemia. This type represents only one-fourth of all the leukemias, in which 85% of this type in adults. It is characterized by uncontrolled proliferation of myeloblasts, precursors of granulocytes. There is hyperplasia of bone marrow, and this is how you can understand the development of AML. So here this is normal and then AML, and then you can also see the origin of AML. Next is age, which is clearly defined now. Clinical manifestations. Then it is fatigue, weakness, headache, mouth anemia, bleeding, fever, infection, sores, external tenderness, and then gingival hyperplasia, minimal hepatosplenomegaly, and lymphadenopathy. How AML complications affect the other parts of body. So this is the same thing which has been summarized in this picture: fatigue, nose bleeding, and then gums and fever, eye problems, chest pains, vomiting, infertility, discolored skin, joint pain, arm or leg swelling, cold hands and feet. Now, diagnostic evaluation, again: low RBC count (HB), low platelet count, low or too high WBC count with myeloblast, high LDH, greatly hypercellular bone marrow with myeloblasts. And this is the summarized form for understanding the pre-diagnostic phase, diagnostic phase, and during the treatment phase. Now, chronic lymphocyte leukemia, that is CLL. Here you can understand the blood count, that is complete blood count, CBC, and then bone marrow aspiration and biopsy, cytogenetic analysis, fluorescence in situ hybridization, and PCRs. Then this lymphadenopathy is present throughout the body, and there is an increased incidence of infection because of T cell deficiencies or hypo gamma globulinemia. Pressures on nerves from enlarged lymph nodes cause pain and even paralysis. The age is between 50 to 70 years of age, rare below 30 years of age. Clinical manifestations: no symptoms frequently. Disease is often detected during examination for unrelated conditions: chronic fatigue, anorexia, splenomegaly, and lymphadenopathy. Hepatomegaly may progress to fever, night sweats, and weight loss. Common symptoms are early, like early symptoms: night sweats, fever, then lymph node swelling, weakness, fatigue, rash, enlarged spleen, bloating, weight loss. And then during CLL progression, you can feel headache, frequent infections, severe anemia, easy bruising or bleeding, potential for other neurological symptoms and other cancers. Now, diagnostic evaluation: mild anemia and thrombocytopenia with disease progression, total WC count less than 100,000 per microliter, hemolytic anemia 4 to 11%, and thrombocytopenia purpura 2 to 4%, and then hypogammaglobulinemia. So now it comes to CML, which is quite different from the other three types of leukemia. It is caused by excessive development of mature neoplastic granulocytes in the bone marrow. The excess neoplastic granulocytes move into peripheral blood in massive number and ultimately infiltrate the liver and spleen. These cells contain distinct cytogenetic abnormalities, the Philadelphia chromosomes, which serves as a disease marker and results from translocation of genetic material between chromosome 9 and 22. Disease progression can be understood from chronic phase to accelerated phase and finally the blast crisis. Chronic phase, that is myeloid compartment expansion, 5 to 6 years, 10 to 15%, and then asymptotic. Then it comes to accelerated phase: new cytogenetic abnormalities, 6 to 9 months, 16 to 30% cases, fatigue and tiredness, splenomegaly, then blast crisis, which is the third phase, increased genomic instability, 3 to 6 months, duration, and cases. Percentage of patients are 30%, more than 30%, increases blast cells in marrow and blood, extramedullary disease. Now, age is 25 to 60 years of age, peak incidence is 45. Clinical manifestations, no symptoms are seen earlier, fatigue and weakness, fever, external tenderness, weight loss, joint pain, pain in bone, massive splenomegaly, spleen, increase in sweating to 60 years of age. Peak incidence is 45 years. Diagnostic process: low RBC count, HB, HCT, high platelet count, early low, lower count later. Presence of Philadelphia chromosomes in 90% of the patients. Clinical manifestations: clinical features of leukemia relate to the problems caused by bone marrow failure and formation of leukemic infiltrates. As leukemia progresses, fewer normal blood cells are produced, abnormal WSC continue to accumulate. Then the leukemia cells infiltrate the patient's organ, leading to problems such as splenomegaly, hepatomegaly, then and so on, blood pain, bone pain, and then oral lesions. Solid masses resulting from collection of leukemic cells called chloromass can also occur. Now, this is the view for common symptoms of all the leukemia, which you can see clearly here: systematic weight loss, fever, frequent infections, lungs, easy shortness of breath, muscular weakness, bone or joint pain, tenderness, then psychologically, fatigue, loss of appetite, lymph nodes are swelling here, the spleen and or liver enlargement could be observed. Then skin, night sweats, easy bleeding and bruising, purplish patches or spots. Then diagnostic evaluations, a history collection, physical examination, peripheral blood evaluation, bone marrow examination, then lumbar puncture and CT scan could be done. Then it comes to some other factors which you can see in terms of figures here. And finally, it comes to the management part where you need to understand the pharmacological management process. And this is mostly for the diagnostic persons who are diagnosing it. It includes the chemotherapy, which is a major form of treatment for leukemia. The drug treatment use chemicals to kill the leukemic cells. This can be a drug or combination of drugs that is also called combinatorial therapy. These can be in the form of pills or injections. Then for AML, the drugs or anti-tumor antibiotics are here listed, which you can see the list. But all the drugs could not suit for all the patients, and for this purpose, the precision medicine is applied. Now it comes to ALL. Again, these are the lists of the common drugs which are practicing used for practicing purpose or diagnostic purpose. Then it is CML, S, and then CLL. So all the management and therapeutic agents are available here. For chronic myeloid leukemia, hematopoietic cell transplant, interferon, leukemia, leukapheresis. For CLL, splenectomy and allogenic hematopoietic stem cell transplant. Nursing managements are quite important for all the disease person, especially in case of cancer. And the nursing diagnosis, the number one here you can see ineffectiveness protection, risk of infection related to neutropenia or leukocytosis, secondary to leukemia or treatment, intervention, assessing client, hand washing techniques, client isolation, low bacteria diet, daily bath, maintain oral hygiene, and so on. Then it comes second, that is decreased cardiac output related to thrombocytopenia. Interventions are also here. Provide a soft toothbrush for oral hygiene. Avoid commercial mouthwash containing alcohol. Don't administer the injection. Do not insert rectal suppository. Avoid aspirin containing drugs. Avoid urinary catheterization. If needed, then only laser size. Avoid mucosal trauma during suctioning. Remove all sharp objects around the clients. Use pressure reducing mattress. Use only paper tape. Avoid strong adhesives. Now it comes third, fatigue related to side effects of treatment, then again assessment for anemia, intervention administers the antiemetics before meal and during drinking, before drinking, then administer the analgesics, provide high the meals like the with the proper supplements, and then monitor the index. Fifth is disturbed body image resulting from alopecia, weight loss, and fatigue. Then intervention is again required. Now, finally, if we could conclude the blood cancer awareness for all these four types, AML, CML, ALL, CLL, the four main types, and their symptoms are here: infection, bleeding, fatigueness, bone, pain, swelling glands, then weight loss, fever, abdominal pain, loss of appetite. No symptoms is identified Symptoms are identified in CLL and is only diagnosed when patients have blood tests. In summary, we can say leukemia is a blood cancer caused by a rise in the number of WBCs count in your body. Those WBCs crowd out the red blood cells or RBCs and platelets that your body needs to be healthy. Extra WBC do not work right. Type 1 here, ALL and AML and CLL and then CML. These are the types. All the four types are mentioned here. They are mainly caused by smoking, radiation, chemotherapy, family history, Down syndrome. Diagnosed by blood test, bone marrow biopsy, spinal tap imaging test, treatment, radiation, biologic therapy, and stem cell transplant. Finally, what you need to evaluate: what is leukemia, what are the normal blood cells, and what do they do? Can leukemia be prevented? What are the etiology or risk factors? What are the symptoms of leukemia? What are the different types of leukemia? How these leukemia could be treated? And what is the pathophysiological view of leukemia? So please subscribe the channel for time to time update and learning the cancer awareness as well as many different things, including data science, bioinformatics, and biology subjects. Thank you very much.